It is totally normal to lose about 50 to 100 hairs a day, but losing more than that may mean there is excess shedding. When you lose more than you replace, you will start to see signs of hair thinning and hair loss. Baldness or noticeable thinning hair can happen for various reasons. Sometimes hair loss is a side effect of a health problem that needs to be addressed and will cure itself when the health problem is properly treated. If you are dealing with thinning hair or baldness, it is important to get to know the root of the problem to figure out how to stop hair loss or renew growth. The medical term for hair loss is alopecia. Regardless of the cause, many people think it only happens to men, but women of all ages can experience hair loss too. Signs that you could have abnormal hair loss are hair thinning, which you might see in a thinner ponytail, bald spots that grow over time, a receding hairline or loss of clear edges, a widening hair path. People with conditions like polycystic ovary syndrome, PCOS, congenital adrenal hyperplasia, CAH, have a higher androgen levels, which can cause female pattern hair loss. Other things that can cause dramatic changes in hormone levels like pregnancy, childbirth, menopause, and hyperthyroidism may also affect hair growth. Even changing medication routines can cause your hair to thin if your medications affect your hormone levels. Being slowly poisoned can lead to hair loss. Poisons that can cause hair loss include arsenic, thallium, mercury, and lithium. If you ingest a large amount of warfarin, it can also cause hair loss. Taking large amounts of vitamin A or selenium is also toxic and can cause hair loss. A sexually transmitted infection can also lead to hair loss. Syphilis is an STI, and if it is left untreated, can cause patchy hair loss on the scalp, eyebrows, beards, and elsewhere. Other STIs can also cause hair loss. Some people pull on their hair often to relieve stress. They may be unaware that they are pulling their hair. The medical term for this is trichotillomania. Continuous habit of such can cause hair loss in both men and women. Drugs, including chemotherapy drugs used in cancer treatment, blood thinners, beta-adrenergic blockers used to control blood pressure, and birth control pills can cause temporary hair loss. Autoimmune disease may cause alopecia areata. In alopecia areata, the immune system flare up for unknown reasons and affects the hair follicles. In most people with alopecia areata, the hair grows back, although it may temporarily be very fine and possibly a lighter color before normal coloration and thickness return. Cosmetic procedures such as shampooing too often, perms, bleaching, and dyeing your hair can contribute to overall hair thinning by making hair weak and brittle. Tight braiding using rollers or hot coilers can cause damage and break hair. However, these procedures don't cause baldness. In most instances, hair grows back normally if the source of the problem is removed, but severe damage to the hair or scalp sometimes causes permanent bald patches. Almost everyone will notice hair loss and hair thinning as they age. Cells continuously grow and die off at all ages. As you get older, cells die off more quickly than they regenerate. As you age, you produce less oil in your scalp, which can make hair weak and brittle. This can also contribute to the overall hair loss and thinning. In some situations, hair loss can happen because of nutritional deficiencies. Low level of iron, vitamin D, zinc have all been linked to excessive shedding and hair loss. It is important to keep in mind that hair growth is a complex process and multiple tests may be needed to understand what is causing your hair loss. Because so many things can cause hair loss, it is best to schedule an appointment with a medical practitioner if you notice any changes in your hair. They will likely use a combination of your health history, including any recent illnesses, surgeries, life stress, or family history, and a physical exam to help narrow down the causes.